We are moving on the third lecture. So there is a rabies in the dog and diagnosis and prevention. So moving on the first initiate discuss regarding the rabies in the dog. So the rabies in the dog, it is also known as mad dog syndrome due to their clinical presentation. So in this there is incubation period. Regarding incubation in the dog, there is incubation period range of 3 to incubation period. Incubation period is 3 to 6 week, and maybe shorter as a 10 days, as shorter as 10 days. So when we look at the longer age or longer age years take or more. So moving on, it exists in two form. Like when we look in the rabies, there exists in two form, and one is furious rabies, and another one is dumb rabies, or short one is paralytic rabies or paralytic form. So moving on the furious form. So in the furious form, there is change in behavior, change in behaviors. Like there is a run away from the home and wander aimlessly or biting without provocation. Like when we look in there, biting or away from home, or run away from home. There is also eating abnormal are seen. There is change in voice or hoarse and barking or growing, change in voice are seen. Then there is also excessive salivation are also seen. And there is forming at the angle of the mouth. So moving on the dumb paralysis. In the dumb paralysis, it is irritative stage in this form. There is irritative stage is absent. Irritative, like above, in which we have discussed previous form. There is the absent stage absent. Then there is disease is predominantly paralytic disease. Then there is dog is unable to feed or travel itself, having or disturbed. Dog may not bite but attempt to the feed might be the dangerous. And there is an infectious as a furious rabies, it is infectious as the furious rabies. So infectious as furious rabies. And if the rabid dog are usually die in the 3 to 5 days after the symptom of the rabies, rarely survives more than a week. So it's die mainly death occur in the 2 to 5 days or 3 to 5 days or more than in a week, or less, not survive more than the week or a week. Mainly seen rabies virus. Now, so moving on the laboratory diagnosis, we have covered rabies in dogs. So now moving on the laboratory diagnosis. For the sample collection, we take saliva, serum, and CSF, cerebral spinal fluid. So, and also we can take a skin biopsy of their hair follicles, follicles at the nape of the neck. Life shape hair follicle, we can also take follicles movement of demonstration. In the demonstration, there's we can see Nigeri's body in demonstration of Nigeri bodies. And there is a postmortem diagnosis. It is a postmortem diagnosis. Postmortem diagnosis. And there is intracytoplasmic eosinophilic inclusion body with the characteristic basophilic in a granule section of the brain. Like there is intracytoplasmic eosinophilic inclusion body with characteristic of basophilic in the granules with characteristic basophilic inner granules like in the when we look at the section of the brain. And there is also like common site like neuron of cerebellum and hippocampus, also in the like common sites, involvement of common sites like neuron of the cerebellum and hippocampus. This negative is seen. There is also cellular technique like basically use a methyl and methanol. Like also we look for the S and E strain, and also there is a cellular technique, cellars technique. In the cellular technique, there is a basic position and the methylene blue in the methanol. Like there is a basic position and methylene blue in methanol. And when we look for the immunochemistry, histochemistry. In immunohistochemistry, there is a peroxidase level. A specific antibody are used to detect the viral inclusion of formalin fixed tissue. Like there is like peroxidase leveled a specific antibody, and that uses to detect viral inclusion. In like formalin fixed tissue. It is alive and this test like determinants of negative body, and there is also more sensitive especially than the histochemistry standing matter. Negative body are detected in the pathogenic rabies may not be detected in the case of 20%, and there is absent of negative body do not rule out the infection. Like if there is not absent of negative body negative bodies. So we can rule out the infection. We do not rule out that infection. So if there is not found in the negative body, it means there is infection. And another matter is detection of the rabies antigen by the direct immunofluorescence test. Detection of a rabies antigen by direct immunofluorescence test. In this test, we can further discuss regarding that is like best specimen for this best specimen semen is hair follicle of nape of neck. It is most sensitive. Then there is a skin biopsy. Corneal smear. We also take. There is like also we can take like saliva of antemortem. Saliva like for in the antemortem. Antemortem. Then there is also corneal impression smear, and usually positive in later stage, and it is sensitive to 30%. Like corneal impression smear, it is like usually late stage and positive in 30% cases. Or sensitive. There is literature. It is 30% sensitive, and impression from the cord surface of brain is postmortem. And we can also look like detect the rabies nucleoprotein. Rabies nucleoprotein antigen in the specimen by the specific monoclonal antibody, and we can look in the tagged antibody tagged by fluorescent dye. Another one, after that there is a virus isolation, serology, and viral RNA detection. So I am going to briefly discuss and things regarding virus isolation. In the virus isolation, there is like mouse inoculation, down mouse isolation, mouse isolation. Then on the right the cell lines, and then there is the brain biopsy of inoculated animals. In the mouse inoculation, there is intracerebral inoculation to the suckling mice may be may be killed after the 5 days, and the brain has mere extended production antibody and assassin, and there is a biopsy in the inclusion of uh, biopsy inoculated animal. There is like examine for the presence of negative body or rabies infection, and when we look in the cell lines, there is like baby master kidney. Like in the cell line, there is baby master kidney, mouse neuroblastoma cell lines are detected by the immunofluorescent. Moving in the serology. For serology, there is a defect. There is antibody present. Antibody in the CSF. Antibody of antibody in CFS and serum by ELISA when detect there is serum antibody appear later, but can also present in the after vaccination, and CFS antibody appear yearly. This is appear yearly. Early. And mouse neutralization test. Also there is done some test like mouse neutralization test MNT. Then there is another hemagglutinin inhibition test HAI, and then there is the complement fixation test CFT fixation test known as CFT. Then on the right is the viral RNA detection. In the viral RNA detection, there is like artificial use, RT-PCR, then sensitive to specific assay, and sensitive and assay. There is no, and when we move on the treatment portion, so there is no specific treatment. Natural treatment sign and symptoms may be the prolonged life, outcome of the most always fatal. And when we look at the isolation of this patient, there is a quiet room, and isolation of the patient like a quiet room needed, and the protector from the bright light and noise water and the cold water. And when these patients are usually also sedative and anti-anxiety drug given, and maintain hydration, and there is also output monitoring is done. Prognosis on mortality 100% preventable by admission the exposure to the therapy during the early incubation period. So these are some vaccine are also formed for this disease. So this is the last video of the rabies. So enjoy it.